stroke is when the blood supply to part of your brain is cut off. This can cause your brain cells to become damaged or die. A stroke can happen to anyone, and there are two main types. The most common is an ischemic stroke, which happens when a blood vessel in the brain becomes narrowed and a blood clot forms, causing a blockage. Sometimes this blockage is only temporary. This is a transient ischemic attack, or TIA, and is often called a mini-stroke. A TIA may feel like a funny turn, as you may experience slurred speech or confusion for a short time, and then go back to feeling well again. The other main type of stroke is a hemorrhagic stroke. This happens when a blood vessel ruptures, causing a bleed in the brain, permanently damaging the surrounding brain cells. Risk of stroke is increased by an irregular heart rhythm, called atrial fibrillation, or having risk factors such as being older, having high cholesterol, high blood pressure, diabetes, smoking, or being overweight. Penny was at home when suddenly her face dropped on one side. She was unable to raise both of her arms, and her speech became slurred. At the hospital, doctors gave Penny a clot-busting drug to break down the clot in her brain. Some people may have an emergency thrombectomy, a procedure to remove the clot completely, or another treatment to try and restore blood flow to the brain. The treatment given will depend on the type of stroke you've had. After her stroke, Penny's family noticed mood and personality changes, and she wasn't able to do as much as before. Depending on the area of the brain that is damaged and how quickly they receive treatment, people may also experience memory loss, tiredness, difficulty swallowing, muscle weakness on one side, or problems communicating. These can be permanent, but many improve over time. Following a period of rehabilitation in hospital, Penny made some lifestyle changes to continue her recovery and reduce her risk of suffering another stroke in the future. Whilst the effects of a stroke can be devastating, if you act fast and get the treatment you need immediately, this gives you the best chance of making a recovery and getting back to a normal life. More information on strokes